Well, welcome to First Friday, Facebook Live and Zoom. Those of you that are joining us virtually, we appreciate you being here today. We have a fantastic group of guests here. We're at Legacy Village in North Stillwater, right adjacent to the Lakeside Golf Course. I wanted to personally thank Emily James and Legacy Village for having us out again for First Friday. This is our second First Friday at Legacy Village, and we're delighted to get to host from this location and appreciate you all, the residents present with us today from Legacy Village. So happy October. Can you believe it? We got some nice October weather for a change. That's been nice to experience a little bit of the fall season. So before I introduce our guest, we have Tamie Young here. She's going to speak about Medicare, an exciting and riveting topic that I know you all will enjoy, whether you're live or whether you're Memorex. So last month, we had almost 1,000 viewers of the First Friday program on our Facebook Live. So those people, there were a lot of folks that watched it after it was recorded, so I'm sure that we'll have some folks looking at it next time or throughout the month as well. We've got some hand sanitizers here, these little spray hand sanitizers. They're back there on that table if you'd like. And we also have a few brochures that might be of interest to you about planning and family planning and that kind of thing. So without further ado, oftentimes we'll hand out tickets and do a drawing. But today I decided we're going to do something a little bit different. We're going to do a trivia, and they're going to be easy trivia, but it's COVID-19 trivia. I want to see what you guys have learned over the last 6 months. Okay, so just real quick, indulge me while I try to impart some additional wisdom if you didn't know some of these facts. So this is a true or false, and the first person that answers gets a door prize. True or false? The novel coronavirus is the same as COVID-19.
Oh, no.
False. That's correct. You're right. It is. Who said that first? We got a win over here.
Bill Schneider.
Here, there's his door prize. That is correct. COVID-19 is the name of the disease caused by the novel coronavirus. SARS-CoV-2 is short for the coronavirus disease 2019. Okay, true or false? A person who has no symptoms of COVID-19 is not a risk to others.
False.
False, that's correct. While coronavirus is much more easily spread by people who show symptoms, obviously, such as coughing, obviously reports are shown and proven that those without symptoms can still transmit. So who said that first? I got somebody here. Who is it? We got Bill Stacy over here. All right. So the next one third one is going to get this little book that somebody wrote. It's like me.
That's a problem we have.
Okay, more than 6 weeks after declaring a national emergency, what share of the U.S. population had been tested? 30%, 20%, 10%, or 2%? 2%. All right. You get a little Stillwater Strong book. Somebody might sign that after the program today if you're still interested. Okay, with that, it's my pleasure to introduce our speaker today. Ms. Tamie Young has done our program for Medicare for the last several years, many years actually now. She's very knowledgeable. She is in our physician practice management group at Stillwater Medical Center. And with that, I would like for you to help me welcome Tamie Young.
Thank you all so much, and thanks for having me. And it's good to see familiar faces from some people that have been at other sessions that I've done. So we're going to, do you need me to talk louder? Yes? Okay.
Yeah, you can take your mask off.
You okay with that?
Yeah.
Okay. All right.
We're 6 feet apart.
All right. Thank you. Does that help? Can you hear me better?
Yeah.
Wonderful. Wonderful. Well, thank you so much. And welcome to all you in Facebook on. So this is different for me. As I was preparing today, I was thinking, well, this is my normal first Friday. I come, I get to visit with my friends, I get to talk about Medicare, and then I got to thinking, oh yeah, but it's got one more element. So, my first experience with Facebook Live was Garth Brooks and Trisha when they did their concert. I'm like, wow, that's a tough act to follow. And then Denise Weber last month, she was on Facebook Live. I'm like, oh my goodness. And then here I come. So Medicare is not the most exciting topic, but I hope you find it informative. And we will definitely have responses to your questions. Those that we're not able to get to in the time frame allotted, we'll make sure that you get answers at a later time. So without further ado, let's talk Medicare. So Medicare, being the nation's largest health insurance plan, continues to grow. And all of you, as you know, yourself and friends, that the numbers of people covered continues to go up. Currently, we're providing coverage through Medicare for 62.7 million people in the United States. That's about, from when I reported to you last year, enrollment is up about 1.2 million. So growing rapidly. Benefits paid out. So according to the estimates that are out already for the year 2020, they're expecting us to exceed the $800 billion mark for benefits paid out for services related to Medicare. Of course, Medicare as a health plan, it covers 3 different groups of people. One, if you're 65 and older, that you're eligible for Medicare benefits. We'll talk a little bit more about the details in a minute. Those under the age of 65 due to a disability, and then those with permanent kidney failure. There's a special fund under the Medicare program that covers those as well. So I talk about Medicare as alphabet soup. You have your part A, B, C, D, just think about it. They just probably didn't know what to call them originally, so they just began down the line. So I'm going to cover the alphabet soup for you today as I go through each part. So let's start with the basics. So how many of you in the room have that red, white, and blue Medicare card? And is that your primary insurance, or do you have another card that you use? Just so I see who my audience is. You have something else as well. You have secondary, but you're going with the red, white, and blue card, not a replacement plan.
No.
Okay. Okay.
I'm going with the different. I'm going with Humana.
You okay? You've got Humana. Okay, good. Then I know I've got a variety in the room, and we're going to talk about both of those things today. First, I'm going to talk about traditional Medicare. Traditional Medicare has parts A and B. Part A was the original plan when it was rolled out in the early 60s. And it covers your hospitalization. Part A is your inpatient, your skilled nursing, those type of coverages that are considered inpatient care. It also covers a portion of your home health coverage. Then you have Part B. Part B was the added benefit. That was the benefit that as we in the medical field, as we started beginning to safely care for patients in an outpatient setting and be able to do more and more, we needed that outpatient coverage because the original plan was designed only for inpatient. Because if you remember way back when, everything was done in the hospital. You spent the night. Now, most everything is done safely in an outpatient setting. So Part B. Part B was not a part of the original plan, therefore it is at a cost. So we'll talk about the cost for it in a little bit. Your outpatient coverage covers your doctor's care. So when you go to your physician's office, when you go for outpatient services at the hospital, all of that is covered under your Part B of your plan or your outpatient coverage. So all of this comes and questions that I get most common are about the cost, or the misconceptions are, well, I thought Medicare was free. Or I was going to go for a Medicare Advantage plan and I find out I still have to pay for part of the traditional plan. We're going to talk about all of that today. But let's talk a little bit about the cost and what we can expect. When I do these presentations in October, CMS has not rolled out all the cost, all the information yet for 2021. That'll be coming in the next few weeks. So the cost information that I present to you is based upon this year, the 2020 year. So for your Part A, as long as you've worked 40 quarters or 10 years in your life and paid into the Medicare program, that is for you at no cost. You've paid in for that. However, if you are an inpatient in the hospital, you will have a deductible. The deductible is related to your 60-day benefit period. That was a part of the original plan that was brought to us with Medicare. It goes in 60-day increments for your inpatient coverage or your benefit period. So $1,408 is the current inpatient deductible. So if you have an inpatient stay, that's your deductible. If you have more than one occurrence in a 60-day period, you'll only pay that amount one time, okay, one time. Now, outpatient, that's where you have a premium. If you're drawing Social Security, your premium most likely is coming out of your Social Security check, or you have some other type of a draft set up to where it is paid. Currently, the premium is $144.60 a month for Part B. That's your outpatient. If you don't sign up for, so for those that are watching that are coming close to the age of 65, and a question that I get most commonly is about Part B is, do I have to sign up if I'm still working? If you have a coverage that covers you currently and will be after you're 65, you can postpone signing up and paying for Part B. Because in my opinion, that would be paying money needlessly for something that you're not going to use because you're already covered. So your Part B premium again is $144.60 a month. Your outpatient deductible for Part B, so you're going to the doctor or outpatient services, you have to satisfy the first $198 annually, and then Medicare picks up and begins paying at your benefit level. Beyond that, 20% coinsurance is what you owe for outpatient services. And when I say 20%, that's 20% of the dollar amount that Medicare deems the service that you are getting is worth. So if it's, $25 or $20, you're going to owe 20% of that, and Medicare pays the other part. Yes.
If your income's over $174,000, how much do you pay?
Okay. If your income's over $174,000, it does go up incrementally. I don't have those amounts, but I can get them for you.
Tim,
And that's a household.
sorry, also there's another question on Facebook Live. So if you have two different stays in a year, would it be $1,408 twice?
If they are beyond 60 days apart. So if you have them within a 60-day period, 2 stays, you pay it once. If your benefit starts all over again, if you're hospitalization free for 60 days, and then you go in again, you would have another deductible. So every 60 days is a benefit period. Okay. I'm going to skip over Part C. I want to talk about Part D first. So I'm going to do these kind of in groupings. So for those who chose traditional Medicare, you would have Part A, Part B, and then you would need a drug plan, and that's Part D. So I want to talk about Part D for a minute. So I remember back in 2006, we had to roll out the Part D drug plans. And some of you have heard me tell this story about I'm in a small community at the time. I'm helping to do some public education on this drug plan. And people are having a really hard time adjusting to, we have to buy a drug plan to help us. Why don't you just lower the cost of drugs? If that's the problem we're trying to solve. And along with that, my dad was also struggling with, I don't take anything. I'm blessed to be healthy. I don't take any medications. Why do I need a drug plan? It was difficult for me to say, well, the government says you do, but that's what I had to tell him. And He chose not. He chose not. That was before we really understood that there would be a penalty if you didn't. So he and my stepmother chose not to do that at that time. So all of that to say that there is a penalty that is added on. Say if you decide 3 years later that you would want to get a Part D drug plan, you would have to have a penalty added onto your premium for the 2-year gap that you did not take out a Part D drug plan. So the Part D it's provided through insurance companies that are contracted by the government. So they find companies that are willing to sell drug plans. There are many, currently there are 22 on the market for this area that you can choose from. And they cover everything from your generic, you get at a lower cost. So there's 3 tiers to your prescription drug program. That's called a formulary. Formulary is the list of drugs that are covered. The generic drugs you get at a lower cost anyway, so it's not quite the benefit, but you still get them even cheaper having a prescription drug plan. Your brand name drugs are probably where you get the best benefit. That's in tier 2. And then you have your biologicals, your insulins, things like that. So 3 tiers to the drug plan. Each of them have a different level of pricing. Okay. Again, cost. So it is possible that you can qualify financially for a 0 premium on a drug plan. There are ways that you can apply. You may get a form in the mail from CMS, but it is possible. But on the average, a drug plan is going to cost you $13.20 all the way up to, depending upon how many medications you're on and your need medically for the plan that you choose, $138 a month. So a wide range in a premium. So from $13.20 to $138. The average deductible. So most any prescription drug plan or PDP, you'll hear it called a PDP, prescription drug plan will have a deductible of average of $435. That's annual. So in other words, you satisfy that and then your benefit begins kicking in. Then there's how many people have heard of the donut hole? The donut hole. That was a big thing when prescription drug plans first came out. That was a gap that over time has been narrowed. Currently, the donut hole is when you and your drug plan, you and your insurance plan both have paid $4,130. Okay, when that amount of money has been laid out to pay for medications, you begin to enter the donut hole. In that donut hole, it's a gap between $41.30 and $65.50. While you're in there, you pay 25% of the cost. 25% of the cost of drugs. So even though your formulary and your co-pays and all of that, they applied up until you hit that point. In that gap, that you pay 25% of the cost. So if you're on several medications, you have a chronic condition where you have maybe some high dollar medications that you take, you're going to get there pretty quickly in some cases. While you're in there, that's what you pay. Once you reach between you and your insurance company the $6,550, then the cost begins to drop. And then it's 5% of cost until the end of the year. You hit January, that starts all over again. And you have a new donut hole for the next year. For those that don't have a lot of medication expense, you won't see that. But it doesn't take long for you and the insurance company to hit the $4,000 range. Okay?
We have another question, Tamie.
Okay.
Do you have to purchase drug plans through a broker?
You do not. You do not. Most everything that I talk about today, as far as plans, can be purchased through the web. There's comparisons, and I'll show you some examples here in a minute. So if you were to go on mymedicare.gov, you will see an option. I want to shop for prescription drug plans, or I want to shop for a Medigap plan, or I want to shop for a Medicare Advantage plan. So this is just an example of what it would look like if you chose one of the 22 drug plans that were out there and you wanted to look at it and see, is that something I'm interested in? It will give you the price, the average premium. It'll let you drill down and look at the details underneath that plan. You can put in your medications, which is very helpful. So if you aren't comfortable, using the internet, using a computer, maybe someone in your family, I'm always happy to help. And I'll talk a little bit more about that at the end of the program. But it does at least let you know you're not purchasing blind. You know at this point in time before you buy if this plan will cover the medications you're on or not. There are local brokers that will help you with that as well. So in our alphabet soup, I'm going to go back and I'm going to pick up the letter C. So letter C, it's been called many things over the years. It's known as the Medicare Advantage plan now. It's the Medicare Replacement Plan. It tells you that if I was currently using my red, white, and blue card, and I choose to go with a Part C or a Medicare Advantage plan, I'm now going to put my red, white, and blue card somewhere in a safe place, and they're going to send me an insurance card for the company that is covering the Part C coverage or the Medicare Advantage coverage. Okay, so this is an alternative to traditional. The A, B, and C, or A, B, and D that I just talked about, that's what I call traditional Medicare. Okay, that's the plan is designed. This is an alternative. So in order to participate and you decide, yeah, I might like to try, and I'm sure this is the thoughts you had as you went into this. No, you did not. Okay, I think and I'll be able to talk about probably how you got that plan. I'll be 65 in 5 years. And I will tell you, as long as I am blessed to be as healthy as I am today, I will shop, and it may be a consideration for me to have a Medicare Advantage plan. Once I start having lots of health care or needs, my thoughts will probably change living in a rural area and not living in a Chicago or an urban area. A Medicare Advantage plan, first of all, you realize you must pay your Part B premium. So when I talked about that $144 that comes out of your Social Security check, that doesn't change just because you opted to go with an alternative from traditional Medicare. That's your buy-in, if you will. That's the one thing that holds you with the Medicare program. So then you choose the insurance plan. And I'll show you in a minute, currently there are 7 plans available in 2020 in this area. They're all Humana. So just so you know, for the Stillwater area, it is Humana that you have the choices of here for a network in this area. When an insurance company is chosen by CMS and they contract with CMS to provide an alternative coverage to Medicare, they agree that they must provide at a minimum the basics that Medicare offers for inpatient and outpatient. So they must cover at a minimum that. Anything beyond that is gravy. They're able to add on all kinds of perks, including membership to health clubs, other types of services. Your dental, your vision can all be packaged in a Medicare Advantage plan, things that aren't covered by traditional Medicare. So that's a consideration, for depending upon where you're at in life, in your health, and wellness care. They are networked. So in order to, or if you choose a Medicare Advantage plan as an alternative to traditional Medicare, you'll want to make sure that the doctors that you select and that the facility that you're going to be treated at, should you need inpatient and outpatient hospital care, are covered under that network. Okay, so there's rules. Just like when you were working, you had insurance, and though the insurance had rules, this is the same thing, exactly the same thing. So just in a nutshell, you have Part A, Part B, and Part D, and then you may have a Medigap plan. That's traditional Medicare. Medicare Advantage, it's one insurance that will have Part A and Part B and potentially Part D, all in one plan, one premium. In other words, A plus B. Accountant, are you listening to me? A plus B plus D equals C. It doesn't really add up, does it? But that's the way it works. Okay, so a little bit about the cost and how it works. Because this, when people come to me after this program, or if I present in Blackwell or Perry, the most common questions I have are about the Medicare Advantage and should I be looking at that? How does it work? And what are the differences? So I like to spend a little bit of time going over this with you, just in case that curiosity is in the back of your mind, and how it works. So like I said, there are 7 options currently in the Stillwater area. 5 of those are plans that have the Part D drug plan with them. 2 of them do not. You would still have to purchase the Part D separately. They have, most of them have dental and vision options that you can have along with the plan. So that's kind of a perk. Premiums from $0 to $112 a month is the average that I could find when I researched them. Now, they could be more just depending upon that drug plan and what your needs are on there. But the average was from zero premium, to $112 a month. Like I said, there's a network. So the cost comes when you begin to pay for your services. Remember when I talked about traditional Medicare, you knew what your deductible was, and then you had your 20% that you could easily calculate from the Medicare, the amount that Medicare allows for any of your services, and you're going to owe 20% of that if it's a covered service. With your Medicare Advantage plan, those dollar amounts may vary because they price them differently depending upon the service and what you would owe. Okay, so for instance, if you go to an in-network provider and you were going to receive outpatient services, you would have a copay. Some services don't require it. Some copays, depending upon if it's a higher dollar, say imaging services, an MRI or something like that, your copay for the visit or each visit could be up to $360 for that service. Then you have coinsurance. So for some things, you would only have a copay, but others you would have to really watch your book and look to see so that you could anticipate what you might have to pay. You might have a coinsurance. A coinsurance could range anywhere from 20 to, or from 0 to 300. Whoops, I'm off. From 20 to 45% coinsurance after you pay your copay. Other things you may owe nothing. They price them depending upon the service. If you go out of network, your coinsurance is going to be higher. An average of, let's say you had a Medicare Advantage plan and you needed to go to the ER. If you go to the ER, you're always going to have a $90 copay for most of the plans that are sold in this area. Now, the reason why I spend time talking about this is I think it's important as consumers of healthcare and Medicare-aged individuals that we understand kind of where we're going in the United States with the Medicare program and kind of what the plan is and why those Medicare Advantage plans were introduced to us to begin with. One, we've heard for years, and we know with the growing number of us being on Social Security and Medicare and needing health care, that the trust fund is getting less as the number of us grow. So they looked for an option of how can we offset that and go to the private sector for it. So they're looking to see how many private insurances can we get to sell a Medicare Advantage plan that works for people in any given community. It's not global because every community is different. Every part of the country, you have different geographic differences, availability of health care. We live in rural America. It's a little different for us here. You know, we like that relationship with our doctors, and staying within a network may be a little difficult for us to get all the services that we need. So anyway, the purpose was that we go to the private sector, we have an alternative to traditional Medicare. The goal right now is that by the year 2025, CMS would like to have 50% of the Medicare population on a Medicare Advantage plan. That's their goal. So it's moving, you know, moving forward. So where we saw earlier that there were 62.2, I think I said, million people on Medicare, they would want 50% of that. If that was the number in 2025, that would be their goal and how they would offset. I talked to you about the web. Google is your friend. MyMedicare.gov is your friend. There are so many tools out there, and I can't tell you how far this has come from a consumer perspective with Medicare, in that they give you tools. It's safe, it's secure. You can put your medications in there. If you don't know exactly what it is, it gives you these little drop downs and you pick the closest one. Because remember, you're just looking for an estimate of what could this do for me and is my drug covered. If you want to look at the benefits of a Medigap plan, and we'll go over Medigap in just a minute, you can put them side by side. Pick the ones that you think you might want to look at. It'll remember them and it'll pull them back up so that you can look and see what all is covered. So get familiar with it. You can set up an account on mymedicare.gov, and that's where, you know, where you keep your explanation of benefits that you get back from Medicare. You probably have a box. You have some place for a file. If you keep them, if you care. If you don't want to have that paper hanging around, you can get it right here. It'll pull them back up for you, and you can see all of them there. The other thing that they have is there's an app for that. So if you want to know what's covered and what's not in traditional, this is for traditional Medicare. Want to know what's covered and what's not? There's an app for that. You just put in, I've got to have a CT of the head. Put it in. Is that covered? Yes. You know, that's the benefits of Medicare and CMS expanding into the web. You do have tools that you can use. All right, Medigap. Some of you said I've got a secondary or I've got a supplement. Medigap is what it's called if you purchase it through Medicare or if they're a Medicare partner. There are many Medigap plans to pick from. Now, some of you have secondary insurance plans, meaning that you still have an insurance from your former employer. How many people do I have in the room that may have been teachers, or you worked in an industry that you still carry that insurance plan and it's now secondary to Medicare? Awesome. That's a secondary insurance. That's a secondary insurance. And it will pick up after Medicare pays. Once you turn 65, it reverted to that of it only serves to pay after Medicare pays. A Medigap plan is the same thing, except for you're purchasing this. You're purchasing this insurance plan for the sole purpose to pay what Medicare doesn't cover. You can buy all different levels. There's currently 10 different levels of Medigap plans that you can purchase. That their sole, the whole reason you buy them is to help you cover what Medicare doesn't cover. Again, you can compare these side by side on the web. You just go in, you put in your location. If you want to just put in a zip code, it'll search in your geographic area and kind of let you know what is available for you to purchase. I talked about that there's 10 plans for you to purchase from. This is another alphabet soup thing. They letter them, A, B, C, D, E, F, and then they skip and there's M and N. And so it's important because each one of those have a specific level of coverage. And so I think that's why they labeled them that way. As of this year, 2020, for anyone who turned 65 after January, beginning January of 2020, there are 2 plans on the market that are no longer available. You had to have been 65 before January of 2020 to maintain those. And that's your Plan F and your Plan C. Those are the 2 plans that pick up 100% of what Medicare doesn't pay for covered services. So some of you probably have those plans. I call them the Cadillac Medigap plans, because if I have that, I don't worry about, as long as I get a covered service, I don't worry about it. It's going to pick it up. My premium that I pay for that plan is covering that. Okay. If you turn 65 after that, starting in January, those plans are not available. And any of the plans that are sold, you must pay at a minimum the outpatient deductible. So you'll find a list. Sometimes they'll mail them to you. You'll get some Medicare information in the mail that comes from CMS, not another company, that will kind of give you, here's the plans. You can get on the web. It lays the plans out. You can see what is covered. If it's outpatient services, inpatient services, there are a couple that you can roll the drug plan in, but most of them are individual. But do they cover me when I travel? Are they going to pick up 100% of what Medicare doesn't pay? Are they going to pick up 75%? All of that is relative to the premium that you pay. Just another reminder, set up a My Medicare account. Very easy to do. All of this information is available at your fingertips. Okay. If I totally confused you, it's a lot of information in a short amount of time, and I'm trying to watch my time because I want to give you, I want to be able to respond to any more questions. Okay. I saw a couple of you, I called you my star pupils. If you got your Medicare and You book for 2021, they usually come out in the month of September. That is a wonderful resource. Everything that I've shared with you today, you can find in that book. Back when Medicare first started publishing those, I have to say, they didn't have a lot of information. It was very basic. It didn't go into detail. You really couldn't research in them, and it didn't break down all the benefits. They've gotten that book to a level today. It's very good. It's very good. It's a wonderful resource. I always have my family members give me a copy so that I make sure that I have it. All right. Now, a couple of common scenarios that I work with. When people call, they ask me questions. So this one says, I'm turning 65 in 2021. How do I sort out all of my coverage options? How do I know what to do? So first of all, and this goes not only for if you're just turning 65, this goes for every year. There's the blast on the TV everywhere saying we're entering open enrollment period. Open enrollment period. Well, that always triggers in our mind, open enrollment period. I've already got Medicare. I think I'm doing good, but am I? Is there something I need to do? Maybe. It just depends on, are you comfortable where you're at? Or do you think that there's something better to offer you and to give you more coverage? But if I was starting out new and I'm turning 65, I'm going to make a list of what are my healthcare needs. Then I need to talk about money. I'm going to evaluate, do I have a budget, or what do I have available to pay for my premiums? And put that down. Am I going to travel in retirement? Or have I pretty much done all of that? I'm going to be here local. That kind of makes a decision. It helps you to make a decision in what your needs are and what a plan that you purchase may need to cover. And then compare side by side, like I just did for you, traditional versus Medicare Advantage. What are the differences? And for my lifestyle and for the premium and for what I will have to pay out of pocket, what's right for me? Okay, so that's one. The other one, question that I get most common, this is a similar scenario. It says I'm 69, I have parts A, B, and D currently, and a Medigap plan, which is plan F. Remember, that's the Cadillac. So this person was 65 before January of 2020. Do I need to look for other plans during open enrollment? Well, like I said, this is your time to look around. If nothing else, to give yourself peace of mind that the decisions that you've made previously still hold true, that this is what you need to support. Even if you want to look at your Medigap plan, say you have that plan F, and maybe you're getting notice that the premiums are going up every year. And you look at it and you think, well, I wonder if I could save a little money on my supplement or my Medigap plan. Well, you might look at some of the other plans where if you paid that $194 outpatient deductible out of pocket, would that be worth it to find a company that gives you that plan at a far less premium? Just comparing those differences to see. It may not be for everyone, but it's something to compare and something to see. Okay. Final thoughts, and then I'll open the floor. You know, I have a passion for working with people in the community to help them to understand their benefits, whether it's Medicare, whether it's other insurances. We work hard all of our lives. We pay good money for healthcare coverage. And I believe that we as consumers of healthcare need to be responsible for asking questions, for not taking the status quo, whether it's just going to your physician for your annual wellness visit to talk through your needs with him, or maybe where you're at in your health plan, or maybe you have a chronic condition, or maybe you've just been hit with something serious that you now have a serious condition. Ask questions. You own this. It is your body. It is your life. When it comes to the health insurance, it is your good money, hard-worked money that you're paying for these premiums. Don't take it as status quo. There are people that can help you answer questions, and you deserve to have those. So I say own it, and I really encourage you to ask questions. Yes?
If you're retired from OSU and you're on the supplement, that's Blue Cross Blue Shield.
It is.
If you leave that for another supplement, you can never go back.
That's right.
Why is that?
Well, that's just how they set up their benefits. And it's probably because of the administrative cost to take you on. So, or to take you back on, because as long as you were an employee of OSU and you had that insurance all those years, the insurance plan is set up so that when those employees turn 65 and they retire, once you start either drawing Social Security, or with them, I think you literally go through the retirement process, they've set up as a benefit to employees that it will revert to that of a secondary insurance. If they were to allow people to just come on and off, I think it probably would be an administrative burden, and I'm not sure that it would be available. It's just part of your retirement. And once you choose something different, that's why you get that package. They send you a package when you go to retire and you have to pick what I'm going to do. That's why. They haven't told me specifically, but that's typically, it's an administrative thing.
Their plan is changing.
It's changing in January.
We received something early October about changing their plan.
That'll be interesting. I haven't heard that yet. So,
Man,
yes.
is there any plan out there where Medicare is the primary insurance and you have to get a secondary?
Repeat the question.
Okay. So his question is there any plan that Medicare is the primary and that you have to get a secondary? Yes, that is the traditional plan. So Medicare, if you choose traditional Medicare, Medicare is the primary. Part B is your outpatient. So your A and B is your primary. And the Medigap is your secondary. You do not have to have, nothing says you have to purchase something secondary to Medicare. It just helps you to be able to cover those varying costs. You could foot that bill yourself and just know that you're going to pay your deductibles and your 20% coinsurance.
Well, the reason I asked that, the best thing we ever had when I first retired, Medicare was the primary and Aetna was the secondary, and that's the best situation I ever
Okay.
had.
And I know, so he said when he first retired, the best thing he ever had was Medicare was primary and Aetna was secondary. So here's what happened back then. And you still have that to a degree. It's just another insurance company that carries this for it. So if you're an AARP member, so a common thing back before we had so many plans to pick from was AARP partnered with Aetna, and you got your Medicare once you turned 65, and then you signed up for your supplement. And AARP was the most common supplement in the United States, and that was your Aetna. And they partnered together, and that's the way it worked. As we fast forward to now, all of the choices of, one, the Medicare Advantage option, that brought more insurances into the market. And then also for your Medigap plans, as they began to expand. They used to be very basic, and now you have the options. And that's because of the higher premiums, the raising premiums over the years. They wanted to give people options that fit their budget.
So that is on the market today.
It is. If you did an AARP today, they partner with United Healthcare. Yes.
You have a retired military policy for 20 years of service. Does that change?
No. So the question is, if you are retired military and you still have your VA insurance, has that changed? And do you have TRICARE as secondary? Okay. So if you had your veterans benefits and then you retired and Medicare became your primary, then you still have your VA benefits to fall back on, because you can still get your medications and things like that through the VA. So you could have that instead of your Part D drug plan, just depending upon how you use those benefits. Yes.
Do you have a long-term care contract? Should you keep that if you have a primary and a secondary?
Well, they're for two different purposes. So the question is, if I have a long-term care plan, should I keep that if I have my primary and secondary insurance already? So your long-term care, that is not covered under Medicare. And that's probably something I should talk about a little bit. And having experienced this on more than one occasion in my family in my lifetime, nursing home care, any type of care like that, when it says home health, that's home health care for a defined reason. You have a diagnosis, you have had a procedure, you've had something that your physician prescribes home health care for you. That is covered by Medicare. Care in a facility that becomes your residence is not. That is not a Medicare benefit. So your long-term care policy you bought, that's a private policy, a personal policy, that's different, and you would want to keep it for that purpose. Anything on the Facebook Live? Anything coming? Yes.
I have Humana, but they're gonna switch to Health Select, I
Health Select.
think in January.
Okay. So you have Humana as as your Medigap, as a secondary, or you have it as a replacement plan. Do you still use your red, white, and blue Medicare card?
No,
You use your Humana card.
yes,
Okay. So you have a Medicare Advantage plan. You have rules that you follow under the Humana plan. So when they switch, it is important to know if there are details in that transition that impacts any provider relationships that you have now. Are they covered? Does it change what you pay out of pocket for certain services? That plan also includes your Part D, so your drug plan is included in it as well. So you just want to know the facts. And once they lay out the details of that, probably the details of what plans are going to be available are going to come once the open enrollment period opens up, starting the 15th. Right now, when I go to look and try to see what's there for you, it's not published yet. Once open enrollment opens up, you'll have that information, and then just compare.
how do we get a hold of you?
I am happy to help. And what I do is, like I said, this is my passion. And I started years ago when my grandmother kept all of her bills in a shoebox. And, I knew that we really needed to be informed and know. So I have some cards up here. I do make appointments, either after hours, or I can have you come to my office. If you call the number on here, please know I am in and out of my office. I try to call everybody back by Friday. So Friday is my makeup day. So that's the day that I try to get a hold of everybody, get your appointments, see what works with your time, what works with my schedule. I am happy to help sit and kind of walk through things with you. I won't help you. I won't choose anything for you, but I want everybody to understand and be informed. So I do have my information up here for you.
Is Humana still the only plan that Stillwater Medical Center?
That is correct. So Stillwater Medical Center is only contracted with Humana as a Medicare Advantage plan. Yes.
I think maybe 3 years ago, I went to one of these meetings that you had at the library. Is there a general example of when the C plan is better than the original Medicare?
So the question is there a general example of when a Medicare Advantage or Part C is better than traditional Medicare? I would say kind of the example that I gave of myself. If you are a healthy individual at this point in time, and especially those just turning 65 and looking to make their Medicare decisions, it would be intriguing to look at it and see if my max premium is only I could get the Cadillac at $135 a month plus my $144 a month premium for Part B that you have to have. And if I'm not on any medications, all those ifs, you would just have to look and see. Or when I go through this with people who come to me and they say, I just want to make sure, can we just walk through this and lay it down side by side? Sometimes the peace of mind, carrying that OSU as a retiree, their plan, you pay a little bit more than when I add up the dollars of if we bought your supplement and went down the traditional route. Sometimes that comes out a little more depending upon the medications you're on. but the peace of mind may be worth that thin margin that you have. So there's a lot to be said for that. Everybody's different. But yes, financially, if you put the numbers to it, depending upon if you have no current health situations, that Medicare Advantage may look pretty intriguing to you. I appreciate you all so much, your patience and your questions. We got one more?
Did I understand you that Humana is the only thing that is offered here in this part of Oklahoma?
In Payne County. So Medicare Advantage plans are sold on a county by county basis. In Payne County, Humana is the only Medicare Advantage plan being sold in 2020.
Okay, you said Advantage plan. Are there other plans you can purchase?
Yes.
All right.
So for all the Medigap plans that you choose traditional Medicare and you buy a Medigap, all different kinds. Okay, I'm going to turn it back over to Scott. I want to thank you all so much for your time.
Thank you.
Thank you, Tammy. Thank you very much. And when Tammy says she has a passion for this, she truly does. She and her team at the Central Business Office, which is located on 12th Street, that's the Stillwater Medical Plaza building. That's where our office is for the foundation and marketing, public relations. She's just around the corner, and she and her team do a great job. So if you have any questions, don't hesitate to call her. Please take her card. I'm going to give your number here on.
It's on the screen.
Oh, it is on the screen. Okay. Perfect. Okay. Well, then in that case, it's 533-6097. And that's 405-533-6097. And you can arrange an appointment or talk by phone if that's more convenient for you guys.
Is there any cost to this?
Is there any cost to a consultation?
Yes.
No.
No.
Oh, no.
No, that is a free service for our community.